Hi everyone, welcome to researchmd.com. We got another great presentation today. Today we're going to look at the new study just released a couple of days ago. A lot of information gathering from, everybody wants to know about this study. Scientists deliberately gave COVID to the patient and they did an analysis, find out what's going on this people, the healthy people who got COVID. Again, my name is Pramil Cheriyath. I work as a program director, director of research, and I teach medical students and medical residents. I'm also an assistant professor of medicine at Hackensack School of Medicine. So let's get into our subject today. So what is human challenge trial? So human challenge trials are, you take a healthy person, you give them disease deliberately, okay? So it has a lot of ethical issues. Is this a proper thing to do? So what kind of, human challenge trials were done in the past? They looked at influenza, they have given people malaria, they have previously done so many studies in that category with infectious disease, and it's a great way to study the bacteria or virus, what's happening, and in a closed environment, okay? So this study was actually published. It's not completely published yet in the pre-publication phase. There's a website called Research Square, and they do the preliminary analysis of the paper before it go through the peer review process. So this study was published in there, and the sponsors of the study were Imperial College of London, Open Orphan, and hVivo. And each volunteer in this study, brave volunteers, right? They got paid around $6,200 each. Let's look at the protocol. They had 36 healthy volunteers, age 18 to 29. And they were all inoculated with the COVID-19 virus. Participant, they have this negative pressure ventilator room, and they were monitored like 24 hours, and they were quarantined. So initially, the 10 people, they were very, very careful. So they were given remdesivir to make sure they don't get into a blown out phase with a huge complication, end up having death or anything. So they were very careful. So once they give the remdesivir, they said they were not getting that sick. They stopped doing that. And only 10 people got remdesivir. Just remember that. So time course, they were quarantined for 14 days, and they followed up to 180 days. So it's a good follow-up period. So results, 50% of the people who were given the COVID-19 got infected with the COVID-19 virus, okay? And the first people who had given remdesivir, they still become infected. That means, remdesivir is not a good agent for prophylaxis, right? So any other importance point of the study is when they did the throat swab, in 1.67 days, they were able to get the viral shedding by PCR. But in the nose, it took 2.4 days. So maybe in today's testing world, we always kind of do the nose swab. Maybe we need to go back and do a throat swab to get our results faster, right? So in 1.67 days, viral shedding by qPCR was noted through the throat swab. Remember that, very, very important. The same symptoms we know, they got sore throat, runny nose, sneezing, loss of smell, and fever. So something important about smell, loss of smell also was another prominent syndrome, I think 60 to 70% of the people has it. Most of them had rapid improvement before day 28, but it can go up to 180 days for complete resolution, remember that. So incubation period, another important point. Before the study started, everybody was saying this 5-day incubation period. That's not the case. In this study, only 2 days. Remember, very, very important. Okay. Results at 28-day post-inoculation, 33% remain qPCR positive, and 2 out of 18 in the throat also positive. At day, it took a while, so maybe to become completely clear of the PCR test, 90 days, all the participants were QCR negative. Remember that, okay? Very important. Now, the other results, on average, viable virus was still detectable 10 days post-inoculation up to 8 days. So they can still shed a lot of virus at 10, 12 days. In the conclusion, these are the major points of the study. Throat swab can give you early detection, 1.67 days, remember. Incubation period, not 5 days, only 2 days. Day 90, everyone become negative. Okay, remdesivir prophylaxis will not help. Number 3, loss of smell and taste can last up to 6 months. And there is a correlation between disease severity and extent of viral shedding. And the viral shedding can move up to like 12 days post inoculation. And there was no serious side effects in this group who took this challenge. Again, we need to understand these are young people. Okay. Thank you very much for watching, and please subscribe to our channel so we can produce more videos like this. Thank you.